kinesiology tape to help with your patients with low back and hip osteoarthritis. Go through kind of some of the ideas that I think of using, or how to use tape with our patients, and hopefully you leave and get back into the clinic and it can help people feel more comfortable and be kind of have more awareness of all the ways we can use our kinesiology tape. So let's jump right into it. As everyone knows here, being users of SpiderTech, what we do for you is provide you the highest quality of product, and in turn you can pass that quality on to your patients, give them the experience they deserve. That reflects good upon yourself, and so that really comes down to us making sure that we provide the highest quality experience for you. All of our materials, all of our processes happen right here in Toronto, Ontario, Canada, and to making sure that you get the best product kinesiology tape-wise. Myself, my experience mostly in golf and tennis, and that certainly jumps into using the hip and low back. From a performance standpoint, with some of the best athletes in the world, a lot of times you're thinking about how to influence the musculature, not necessarily the structure, the bone structure, to optimize hip rotation, to optimize low back function. But then once you jump into treating in the clinic with a lot of our older population, a lot of the people who are struggling with pain, that's when you start to deal with our arthritis and how that affects the rotation of the hips, how that affects the low back, the interplay of those two things. And now we're trying to increase the range of motion as much as we can. And two different ways or needs that these people have, but it comes down to the same thing as we're trying to optimize the way that the body and the brain uses these two things in our torso, and then you can help your patients with their performance. All right, so as mentioned, we're looking at our OA today with the low back and the hip, and we'll do that theoretically. We will also do that in some application videos, thinking about how we can apply the tape as well to help our patients. The beauty of SpiderTech is the Pro Cuts. In addition to just the high quality product that they provide in terms of the adhesive, the cotton, we also offer Pro Cuts, which makes your life easy because they come specifically made for the area of the body that you're after. So the low back and the hip Pro Cuts obviously are tailored to today, but we have multiple Pro Cuts for all different parts of the body, making your life easier because it comes pre-cut. You don't have to cut it. It lasts longer. It's a better experience. It looks really good, so your patients can walk away feeling like they got the highest quality experience with your treatment. All right, so we'll jump right into what our strategies are, when we do that, the things that I'm thinking of, other than spelling strategy incorrectly, the things we're thinking of is we are looking to restore tissue tension. And so we'll look at some research today, and a lot of it is from hot off the press from 2025. And the interesting part of this is that can be decreasing tissue tension, that can be increasing tissue tension. It really is about normalizing or getting you back to what optimal would be. And we'll dive deeper into that. And that's how we're kind of protecting the low back, protecting the hip, and taking advantage of range of motion as well. Range of motion will be our second piece. Third will be our proprioceptive awareness and our balance. And in my mind, these all come from the same mechanism of action. And really, even the pain control, which will be sprinkled throughout all the different research we look at, they all kind of come from the same mechanism of action, the same interplay and with your body. And really the beauty of the simplicity of how kinesiology tape works, but how it affects so many different things. It's going to come down to simply how the tape gets on your skin. The elasticity in the skin or in the tape is going to lift up the skin the same way you would if you stretched an elastic band. It would retract back. The tape is going to retract back. It's going to lift your skin, and that lift does a number of things. But the thing that all these outcomes have in common is by the tape constantly providing rub on the skin, you are stimulating those mechanoreceptors in the skin, the connection between the nervous system and the skin. And so by doing that, by constantly stimulating it, you're able to normalize the tension. So if the tissue is tight, we can normalize it. If the tissue is weak and flimsy and kind of not functioning properly, we can normalize it. By normalizing it, we can increase or optimize your range of motion, and certainly you can understand how that would increase proprioception as well and balance, because you know where you are in space. Your brain gets more information, and you can use your body more effectively. But that same mechanism also affects pain control, because not only do we not get injured because of all the things that I just mentioned, we also can take advantage of the gate control theory of pain, where we're going to almost block, inhibit, or muffle the pain sensation coming from that specific area, and then that turns out to feeling less pain, moving more, and again even killing or muffling the pain sensation even more. And so all these things come together, but they all seem like different ideas, but they're brought together by this one mechanism of action. Okay. So we'll start with a paper from 2017, and we'll be quick on this one, but I want to get the idea that kinesiology tape, or I want to prove the idea that kinesiology tape can affect the tone or tonicity or stiffness of muscles. And so we'll differentiate a little bit here, and that tone being what we perceive as therapists as to what a tight muscle would be. So like if we put our hands on it and we think, okay, that's tight. It feels like it's activated. It feels like it's contracted when it should be relaxed. And then stiffness being what your patients say, oh, my back feels stiff. Oh, my hip feels stiff. It's the perception of your own body feeling like it's stiff or sore or things like that. So that's going to be the differentiator here. And so both are important, but in terms of function, the tone is going to be what we kind of focus on momentarily. So if we look at tone and we look at what we'd expect the tone changes to be with tape, and again, it's because we are constantly stimulating the mechanoreceptors. Essentially, we're providing some rub on the skin. It's a low-grade soft tissue treatment all day, every day, with some elevation. So it's like a combination of soft tissue with maybe some cupping at a low level all day, every day, being able to kind of use 24 hours a day. So we're looking at right away of a 25% improvement or normalization of tone, and then after a week about a 44% improvement in tone. I will say that it is in concert with using electrical stimulation and heat as well. But after 1 week, we saw that the electrical stimulation and heat gave a 16% decrease in tone, where the adding tape in was 44% improvement. And this is a supraspinatus. This is someone with a rotator cuff issue, and so this is an injured person so the body you would expect would be protecting the area, increasing the tone. So again, this is decreasing the tone to normalize the tissue tension. If we look over to stiffness, this is how your patient perceives it. After about a week, we saw a 16% improvement in how they perceive the stiffness to be in their supraspinatus. So great. We'll dive into a little more real life, or even maybe more into the hip, low back areas using those same principles, where the next study we look at, and it's an older one, but it demonstrates what we're after really, really well here. It looks at the tone of the in the stiffness really of the erectors muscles in someone with chronic low back pain. And I think someone with chronic low back pain, that would fit into someone with osteoarthritis in the low back as well. So certainly you expect this is an older population, and a lot of these people with chronic back pain would have osteoarthritis. Kind of the chicken or the egg. The arthritis can cause the pain, the chronic pain can cause the arthritis. But no matter, this is kind of the population we're after here. And so what they did with this study is they had the people with chronic low back pain bend forward, and a hallmark sign of chronic low back pain is even when you bend forward, your back muscles don't relax. To get maximal flexion, we want their back muscles to relax so we can bend forward as much as possible. The chronic or the change in the back muscle tonicity doesn't allow it to happen. So they used their EMG to see, okay, do the erectors relax? Yes or no? And then they put tape on them, and then they had them bend forward again and said, okay, do the erectors relax? Yes or no? And what they found is that 43% of people who had a forward bend, a toe touch, that without tape, their erectors did not relax. 43, almost 44% of them instantly with tape relaxed. And so really quick and easy. We see that improvement in how interesting that is. Just having the tape on there, just having the rub on the skin was able to normalize the tissue tension and allow the erectors to act like they should when you flex forward. And then from a pain standpoint, or you could say probably a stiffness standpoint, that 33% of the people in the study had they reported at least a 2-point decrease on their pain on the visual analog scale instantly. So we get a sense where we kind of saw before, which was tone decreases more than stiffness, but both are very significant numbers in like an instant standpoint. So if you're thinking of where that puts you in the clinic, all of a sudden you do your treatment, it's very effective because you've done it for years most likely, and now you add in one modality that gets these type of benefits. All of a sudden the take-home therapeutic value for your patients goes up significantly because just the tape alone decreased the pain level by at least two points, and then those back muscles are actually going to relax for what the duration the tape's on. So a very significant and interesting study here looking at just that ability to instantly decrease the tension. And then they conclude in the study that kinesiology tape is promising as both immediate and short-term pain relief therapy when applied to chronic low back pain patients. It rapidly reduces abnormal paraspinal EMG activity and may therefore be effectively used to complement a physical rehabilitation program. Excellent. So, excuse me, we'll jump into an application video here. We'll break it up a little bit. And although this is on the hip, and this would be a common one that I would use for someone who we thought was, who I thought had a quad hypertonicity, someone who had kind of some anterior pelvic tilt, someone who felt like the quads didn't relax when they should relax, affecting the pelvis, affecting the low back, and essentially leading to not only pain, but if we're looking at a sport like golf or any kind of rotational sport, if we get into that anterior pelvic tilt, that position is going to rob us of our rotation of our hip just because of the winding around of the ligaments around the hip itself. And so by neutralizing or getting back to a pelvic position that is more preferred, we can not only get rid of pain, but we can optimize the performance of the pelvis and the hips as well. And then even from a low back standpoint, if the pelvis is driving us into extension, all of a sudden we get rotation through there, and now we're grinding up our low back, and our low back is sore and painful. And so the key, I guess, is what I'm getting at is use your clinical tactile knowledge, use what you feel to get the tape on the areas that the tonicity is abnormal, and in this case, where the tonicity is high. If we jump into what I'm thinking when we're applying, while we're applying here, I'm going to stretch the quad, and the reason being is that if I didn't stretch the quad and I put the tape on, if they get into hip extension, they get into knee flexion, the tape, which only has a 40% stretch in it, if we run out of that 40% by getting further into joint range of motion, we end up with skin irritation and skin damage. So I'm always going to stretch the muscle I'm applying to, and then I'm going to apply the tape without stretch, because really all we're looking for is that tape retracting back and lifting up. In this case, I'm not looking to mechanically change the position of the quad. I'm just looking to provide some rub on the quad all day, every day, and hopefully use the nervous system, use the brain to normalize the positioning. So I'm going to get tape over the area that I feel like the quad is tight. I'm going to use the hip pro cut in this case because it is perfect size-wise, but you could also use a roll. You could use any kind of tape application as long as you get tape over top of the area that the quad doesn't relax. And commonly I'll take that up into the pelvis too. Again, I can go up even higher, but for the purpose of the video, this covers just to just below the pelvis. Get tape over the spot where it feels tight, even if that's up into the tendons of the quad, where it attaches to the pelvis. All right, excellent. So we saw that where we looked at the decrease in the tone. Now we'll look at the opposite. So now we're going to look at trying to activate the glute medius, and then they use the IT band here, but I guess more like the TFL, because you're not really activating a sling of connective tissue. But this brand new study, 2025, looked at enhancing drop landing mechanics in soccer players. So they use kind of your standard like plyometric drop jump as the way to evaluate, and they looked at getting tape on the lateral hip and the impact that had. And again, these are healthy people, so I suspect that we would get even better results if these were not healthy people, if these are people with known pathology in the hip, or reason why the glute medius would be kind of weak and not functional. So the first outcome measure they looked at was a knee separation. And so as you can see, like in pre-landing, landing, and takeoff, so you can think of like a drop jump, like pre-landing, landing, takeoff. They looked at the knee, hip, and ankle, and in most of the cases here, we see an increase in the distance, and they attributed that to having a stronger glute medius, so the knees didn't collapse inwards, and you're able to you keep your mechanics well. In this case, we're looking at an average of like 2 centimeters difference on like turned outwards, and so if you think of like someone who can't squat, where their knees collapse inwards, and we're trying to get them to keep their knees outwards, use their pelvis, use their hips, use their glute medius in a better way here, glute maximus in a better way here. That's what they saw. I mean, I don't really know what 2 centimeters means in terms of benefit. I know that at the very least it means that the glute medius is activated more you would expect to keep it out there, but you can see the results here, about a 2 centimeter difference. So if anyone here is trying to correct or focus on squats, or see someone like knees collapse when they're doing drop jumps, like this would be the way to be a good thing to add into your treatment programming. What we do look at next is the EMG activity, which is a little more, I think, objective. It's something that we can kind of take home and like really get some numbers on too. At least me personally, I find that easier to conceptualize. And so if you're looking at the TFL here, but in the glute medius, if we jump down to the dominant glute medius, we're looking at where the pre-landing with and without tape, we're looking at 118%, so 1.38 to 3.1 is a 118% improvement in the EMG activity of the glute medius. The landing 5.4 to 6.65. If you go down to glute medius dominant, that's a 21% improvement. And then in the takeoff, we're looking at an 8.1 to 10.3, a 27% improvement in EMG, or increase in EMG activity. The same is very similar with the non-dominant leg. And we see similar things with the TFL as well. But yeah, like giving us the data that not only did the knees stay outwards, the knees stay in the position we wanted to, but we got it coming from the places we wanted to, which was the lateral pelvis. It wasn't like they were somehow manipulating it with their feet or something like that, but it actually was coming from pelvic activation of the glute medius and the TFL muscles. Where if I think back to like my earlier days of coaching someone in a squat or drop jumps, that's what I was trying to do, and now we have the data to prove that actually is happening, and by just throwing some tape on the hips over top of the muscle. And then if you look at during gait, so this is no longer during a drop jump. This is during running. We saw with glute medius, we saw a 7.3 to 9.1 and 7.5 to 9.38. Those are both a 25% improvement in the glute medius activation while running. Interestingly, they didn't find that led to difference in stride length. It didn't lead to any difference in the things that you would need to coach in terms of the running performance or the running mechanics, but it did lead to a glute medius being more activated and the pelvis being more stable through running gait. And then if we look at a quick graph here where we can get a sense of the dark orange being the tape side, we see that in all instances, the glute medius and TFL activity was greater while running by just simply putting tape over the top of the lateral hip. And so they concluded, in summary, this study provides evidence that the short-term application of kinesiology tape can positively influence lower limb alignment and muscle activation during drop, jump, landing in soccer players, specifically improvements in the knee-ankle separation distance along the increased EMG activity in key hip abductors suggest enhanced neuromuscular support during the impact and propulsion phase of jumping. However, as I mentioned, these effects did not extend to changes in basic gait parameters, indicating a task-specific response to taping. So you still need a coach, you still need someone to teach you how to run, but the tape will help you prep your running performance if glute medius activation was a problem in someone's running gait. Okay, so we see a study that says that EMG activity goes down when muscles are tight. We see an EMG study that the EMG activity goes up when muscles are weak or not being used properly. We see a cool study here that ties it all together. So again, a recent study, 2021, and they looked at the effects of kinesio taping on hip abductor muscle strength and EMG activity in athletes with chronic ankle instability. And here we see the tape application they applied. Couldn't be more simple. And that's right over around the greater trochanter, so we kind of get the TFL glute medius activation, a little bit of glute max as well, in terms of like the contact with the tape. And what do we see here? We see by applying the tape, and instantly we see a force production of a 9% increase in the ability to use or generate force in those muscles, and in those muscles being the glute medius, and that we see a 8% decrease in the EMG activity at rest. So the muscles at rest decrease, the muscles when called upon increase. That seems like a very convenient and optimal combination, and that kind of sums up everything we just saw with the two different studies, and a big reason why I use tape on my hip in a very common thing for me, And I feel like people who understand how to use kinesiology tape, this is kind of this is something they would use on a very regular basis, because you can feel the difference. And I also personally, I use it a lot when I play golf, because I can feel the proprioceptive, and I feel like my balance and control is better as well. So that takes us into even to kind of the next piece. What they also found, so in conclusion, the application of kinesiology tape is effective in increasing muscle strength and reducing EMG activity of the gluteus medius muscle in athletes with chronic ankle instability with ipsilateral pain, abductor weakness. Thus, the application of kinesiology tape can be used as an effective tool in combating hip abductor weakness. Kinesiology tape can be used to prevent injuries, for rehabilitation, as well as enhancing athletic performance. That's a great point to bring up. I would suggest that you use this when you see someone who you think has glute medius weakness. This is not going to be as good or even really measurably good for someone who is already strong in that area. Kinesiology tape, as a rule, in my experience, is great for people who have problems. It doesn't make you super good if you already are good. All right, excellent. So that is our piece where we looked at normalizing tissue tension, both high and low. We get now into our range of motion piece. And we use the glute, or the piriformis in this case, because piriformis tension can decrease rotation of the hip. And so that's how I want you to be thinking about how we can improve the range of motion using tape. Is we're going to normalize the tissue tension to normalize the range of motion. If someone has hip arthritis, I'm thinking with when that patient's in front of me, is how much of this is bone on bone and how much is tissue tension that is decreasing range of motion. So even though they might have hip arthritis, it's not about, okay, can we get the hip back to what you would consider to be normal range of motion, like if they're lying supine, being like, oh, can I get 40 or 45 degrees of internal rotation? No, I'm thinking, okay, there is arthritis. How much of this is bone on bone restriction, and how much of this is tissue tension that is in addition to the bone on bone that we can squeeze extra range of motion out of, allowing them to optimize their own performance. Because you get when we're dealing with osteoarthritis, it's like, how close are we to hip replacement? How can we maximize the rotation so the back doesn't get beat up? How can we maximize hip rotation so the knees don't get beat up? So kind of taking care of the tissue issues is a big part of that problem. All right. So in this study, you see how they taped. This makes total sense if we're just trying to have impact on the piriformis muscle. And you notice that the hip is in the position there is, that the hip is flexed and internally rotated because we're trying to stretch the muscle we are applying to. I would do this all the time if I feel like I'm trying to get tape over top of the glute max, over top of the piriformis. I'm going to flex the hip up, bring the kind of lock the ankle over top of the bottom leg, and just kind of allow the hip to kind of internally rotate a little bit. And then generally I'm gonna tape from kind of SI joint down to hip. I'm gonna put kind of a strip there if I'm trying to kind of affect the glute medius or the glute maximus or the piriformis muscle. All right, and we look at what they found, and again we're looking at kind of like immediate and 3-day results here. And again, we see some pretty impressive numbers. So if we're looking from a hip internal rotation standpoint, which is so valuable to our athletes and to our people trying to avoid causing problems in surrounding tissues, instantly we saw that there was a 3 degrees increase in internal rotation. And then after 3 days of tape use, we see that there's a 7-degree increase in internal rotation, where with our control group, we saw that there was nothing. So that's good. I mean, that's good in that we can reliably increase the range of motion of our hip by just simply getting tape on there. And then going back to our pain numbers, which again was weaving throughout all of the studies because all the things we've talked about cause pain. We see that instantly that there is a 31% improvement in pain, or 2 points on the VAS scale, and then a 40% improvement in pain after 3 days, or almost a 3 points on a VAS scale for people with piriformis syndrome by just simply putting kinesiology tape on. And again, the exciting part is tape is not the only thing you're going to do. You're always going to do your normal treatment. You're going to do your exercise. You're going to do your soft tissue. You're going to do your adjusting. You're going to do your stretching. Like all the things that you're going to do to help someone with this condition. Tape is the finishing move. You're getting it on there afterwards. It's the last thing you do. It's getting on there. It's on there for 3, 4, 5, 6 days afterwards, and it provides constant 24-hour-a-day positive outcomes for your patients. And so it's really a no-brainer. It's taking the place of nothing you're doing, and there's only upside. Again, if you take our recommendations and stretch the muscle you're on, you're really limiting, all but eliminating the chance of having skin reactions or negative side effects from the tape itself. So in conclusion for their study here, improving range of motion and decreased pain intensity obtained from the study may suggest kinesiology tape application as a technique highly appropriate in patients with soft tissue involvement. Therefore, kinesiology tape can be prescribed for patients with trigger point, especially when pain relief and increased range of motion are the short-term goals of the treatment. All right. So we'll dive into another application video. This is using our hip pro cut again. The beautiful thing about the hip pro cut is just the versatility of it. So again, you can get it over any part of the body that you want. I'm gonna show here with this video. I mean, everything we said before for the quad kind of applies to here as well. So we're going to stretch the area we're going on. We're going to apply without tension, and we're going to apply over the place that is tight, that you feel like it's like there's hypertonicity, that the tissue tension is increased, not really, or decreased. And then the last piece is this is how I'm going to apply over top. With patients to make sure that I'm not having to take their pants and underwear off. It's a really effective way to do it, and then make sure that they can keep clothed and feel comfortable. So with our pro cut here, I'm going to remove the number 1 indicated piece, and I'm going to place it right over top of the greater trochanter. So I'm going to come underneath the underwear, underneath the pants or the shorts, never kind of exposing them. And then I'm going to stick the number 1 over top of the greater trochanter, and then from there I can manipulate the hip position to stretch it out, but I can do it with the clothing on, so it's beautiful. So if I'm going glute medius, I'm going to bring the leg. If you kind of like think of the legs stacked up one another. With glute medius, I'm just going to slide the top leg forward a little bit. If I'm going glute maximus, I'm going to bend the knee, bring it up, and flex the knee up forward, internally rotate a little bit, as you see there, and then get it over top of the glute maximus or piriformis. And then as I get into our IT band, I'm going to drop the leg behind, excuse me, and go down over top of the IT band towards the knee. So it makes applying the tape to the hip super easy. It makes it really effective. You can manipulate it any way you want. You can cover any muscle you want, and you can do it having your patients feel secure and without exposing really much skin whatsoever. All right. So we will look at another study here that highlights what we can do for the low back in terms of range of motion. We saw what we can do for the hip in terms of range of motion. This is the low back version of that. And so, although an older study, 2007, it looks at and proves our point beautifully, and I don't think ever is going to be affected by time. So you can see the application they applied tape-wise. We see kind of like the Y shape. They went up the erectors. Similar to our initial study where we looked at the flexion ability to kind of flex forward and the erectors to relax. This is looking at the exact same thing. And instead of looking at the EMG of the muscle of the erectors, we're looking at what the ability to bend forward is in terms of like how far can they get down into a flex position. And so the results real simple. If you look at lower trunk flexion without tape, they got 63 centimeters down, and then after they got 81 centimeters down instantly. So a 41 or a 14 centimeter improvement by placing tape on. And so we also look at the trunk the trunk extension. We see that the tape didn't do anything to trunk extension. Well, I mean, that makes sense to us. If we're going backwards, we would have needed to tape the abdominals if we're thinking like what muscle allows us to get back there. Because it's not like, so I guess it's not as if the tape pulled us into extension. The tape just allowed us to get into flexion. So that's positive. That didn't have a benefit because that proves that our theory is kind of what we're thinking is still sound. And with trunk lateral flexion, again, we just have tape on the erector, so it's not like any kind of a lateral chain was affected with the tape on. So I think that the fact that flexion was affected, extension and lateral flexion wasn't affected, again, proves our thought process perfectly. And they concluded that the effect of kinesiology tape using a Y flexion pattern may improve the active range of motion of lower trunk flexion. Medical professionals may apply kinesiology tape to the patient during or after treatment and rehabilitation to support low back musculature, to encourage the tissue healing process, and to avoid limiting the enhancement of improved trunk flexion range of motion. Okay, fantastic. So we look at how I would do that in a application video. And so what would it like, I don't know, and maybe I just don't do it in the clinic, but like, I don't think I'm gonna measure a toe touch and have that as the trigger for me to kind of get into it. What I'm generally going to apply this based on is the person lying prone and me getting my hands on their erectors, getting my hands on their QL, getting my hands on their obliques, and it feeling like the muscle is just tighter than it should be, feeling like the muscle is contracted when it should be relaxed, feeling like the muscle is hypertonic. I guess you could then go into a toe touch to prove that, to prove the outcome measure, which would be great. But that would be generally the reason why I'm going to get tape on here to increase range of motion. And so when we're applying to the low back, this is our low back pro cut. I'm going to generally, I'm going to have the person standing, although they're not doing that in the video. They're just slouching forward. But I really want to make sure that I'm getting full lumbar spine flexion, because to make sure we don't ever run out of range of motion and the tip and the tape pull on their skin and cause skin irritation. So generally, I'm going to have them stand, hunch forward as far as they can, and then I'm going to apply the tape up the erectors without applying any tension or stretch in the tape whatsoever. The beautiful thing about the ProCut is it gets up the erectors, but also covers the over top of that TL fascia up towards the opposite shoulder, and we kind of get the impact in through like the bottom part of the lats into the fascia, the QLs, as well as the erectors. So this is going to be a really easy solution for me, for someone who has a low back flexion limitation, or just a muscle tension that seems to be too high. All right. So that takes care of our range of motion piece. So we've kind of had we've kind of looked at our normalizing tissue tension. We've looked at our range of motion. We've looked at our pain. And then we're going to wrap it up with looking at the proprioceptive improvements or the balance improvements of using tape. And so what would trigger me to look at this would be someone who has an injury, someone whose hip was weak, someone whose back has had a back injury, who feels like they just don't have like good core control, they feel like they're not good and stable, or someone who we're working on like a strength or stability program. That's kind of who I would suspect would benefit from this. Also, like after giving birth and body composition is changing. So, whatever, if there's a reason why there'd be an interruption between the brain and the pelvis, the hips, the low back in terms of body awareness, that's what would trigger me to get tape on there in a proprioceptive balance type way. Or maybe like going back to what we saw before, like a Trendelenburg issue, where like we just get that weakness in the glute medius, or like we just get that body that doesn't seem to be able to support what we would say would be normal gait or proper gait. All right, and then this one and brand new study as well, 2024. So again, all new stuff that we're constantly bringing you here at SpireTech. And so this study, the effect of kinesiology taping on posture, balance, and gait in patients suffering from low back pain. And then most of the people in this study were also older as well, so again, with the arthritis angle. We're looking at just simply standing on one leg, a stork stance, with eyes open. Real simple objective measures here. And what we see is that while standing on one leg, with the left leg, without tape, we got an 8% or 8 seconds. With tape, we got almost 13 seconds. And so instantly we see with tape on the low back, we see a 52% improvement in their ability to generate balance, or the proprioceptive awareness, I guess balance being the outcome. And then on the right leg, we see a similar thing, 8.5 to 13 and change, a 54% improvement in their balance just by putting tape on their low back or someone with back pain. So, I mean, in this case, it's like these aren't people who even have a balance problem. These are people with just back pain. And then we're seeing that huge improvement in balance by getting tape over the area. Again, the thought process is these people have back issues for a while. That leads to changes in the nervous system of that area. That leads to, you could expect kind of deep stabilizer issues, multifidus issues, and the tape helps you overcome that, helps you reconnect with the brain, and help you use your core more effectively to just increase something as simple as your one-legged stance. And then if we dive into, again, our pain side of things, I mean, they have a number of outcome measures here that have been positive in terms of straight leg raise, a get up and go test, which all saw big improvements. But we look at the very bottom there, their visual analog scale from a 5 and a 5.4 to a 3.1 instantly, just by putting tape on there. 43% improvement just by putting tape on, which is the last thing you're doing. I keep saying that, but like it's exciting. Like you can see these big improvements in addition to everything you're doing to see big improvements. And so as therapists, like you're going to do great. And then the summary of the results of the study. The results are presented in the tables, as we saw. Both dynamic kinesiology tape and VFB, which the control group was a balance. They did some balance education and balance training. So both kinesiology tape and balance training had statistically significant effects on postural control, balance, gait, coordination, and pain. No effect of gender was observed. In both groups, the significant effect of the intervention on balance was better perceived in under 55 years of age. No side effects of either kinesiology tape or VFB were observed. So instantly better gait, balance, pain, coordination by putting tape on there, and as expected by doing balance training. But the two things were looked at separately. So exciting. I mean, that's just what I said. Maybe you just combine those two things. You do balance training and tape, and now we're seeing even better results, even bigger results than like the bigger results we already saw. So maybe we go from like a 43%, you combine those two things, and like who knows what you're getting in terms of combining the training with the tape as well. All right. So to review, restoring our proper tissue tension. We saw an exciting way how we can increase tissue tension when it's needed. We saw how we can decrease tissue tension when it's needed. We saw how those two things have a huge impact in our performance and also our range of motion of our hip, our low back, also our proprioceptive awareness and balance, all coming together by affecting the nervous system, all coming together by normalizing tissue tension, all coming together by allowing the brain just to be more aware of where we are in space. And then as a result, we don't create pain because we aren't causing friction, aren't causing issues and creating new pain, but we can also have an effect on the current pain through our gait control theory of pain. Look that one up. It's if you don't remember that one from school. So yes, there's multiple mechanisms here, multiple ways to see these, to get to these great results, but they all come back to the fact that the tape gets on the skin, it lifts the skin, and what that does for the interaction between the skin and our brain. When we wrap things up now, our beautiful thing about our tape is that we can affect so many different things. I mean, today we saw that perfectly, how we can think our way through using tape for multiple different ways or reasons for using it. It is the treatment between treatments, which I've mentioned many times, where it's not the first thing or the second thing we're doing, it's the last thing. It's the thing that takes the place of nothing you're already doing, and it's the thing that spans the gap between your treatments. And then also because the visual appeal of our Pro Cuts, the visual appeal of everything and the quality that we provide you and for your patients. When other people see your patients walking around with our unique shapes on, it creates a conversation which leads to your patients talking and speaking positively about you as a therapist, about the high quality products that you're using, the high quality therapeutic value that you provide, and my expectation would be that you would receive more patients as a result of all those positive conversations. Thank you, everyone. We'll jump into our Q&A. Fire away. Let's if anything that didn't make sense, anything you had thought about this and other branches of kinesiology tape, please feel free to ask the question. And another very successful webinar in the books, number 20 nonetheless. And I will say that all of our webinars, all 20 of them, are platformed in our school platform. You can get you'll get that when you sign up as our medical professional on our website, completely free of charge to sign up as a medical professional. You also receive our maximum discounts on products. And in addition to, you get access to our school platform, which has all of our content, which is quite high quality, as to how to tape, why to tape, the science behind it, the practical application ideas, tips, tricks. Everything is housed there, free of charge. It is as good as you're going to get without being there in person at an in-person seminar, but it might even be even better from a scientific standpoint, because you can pause it, you can use it on your own terms. You get in-depth information about how it works, and it's all for free on our school platform. In addition to, you can ask questions and we'll answer them. You can give our next topic for our webinar number 21. We got to this topic of osteoarthritis because someone brought it up on our school's platform. All right, Robin asks, would you combine both hip and low back taping for someone with both hip OA and also degenerative low back pain? And yeah, absolutely. Absolutely, I would commonly do that. My thought process behind that is I'm going to try to find a way. I guess my bias is most times the hip OA, the decrease in range of motion there, it's going to affect the low back OA, because it's going to cause your back to do more fine range of motion there, which is going to cause a injury of excess motion. So that's the mechanism that I think I see most often. So I'm going to get tape over top of the hip to try to increase range of motion, and then excuse me, I'm going to get tape over top of the low back to try to optimize awareness of the low back, so that you can control the range in the low back, and so we don't grind the low back because of excess range of motion for what it can handle, due to the OA causing a decrease in ability to create range of motion at the low back. So that's something that I would do all day, every day. Get tape on the hip to increase it, get tape on the low back to control it, and combine those two things together. And how would you, and Andrea asks, how would you propose taping for spondylolisthesis at L5-S1 in addition with patients with degenerative disc disease, but would taping assist in stabilizing the movement of the spine, and how would the best way be to tape? So if I'm thinking of spondylolisthesis at the low back, I'm not trying to limit extension, because that's going to be generally the part where we're concerned. So it would take a lot for me to, I've done this times over the years, where we're like, okay, I'm going to try to limit low back extension by getting tape over top the abdominals. So I would go like tape over abs to pelvis and just make it so you can't extend. And so if it was a fresh spondylo and you want to limit low back extension, that's what I would do. I would get 2 strips on either side, ribs. I would kind of like have them take a normal proper rib pelvis position. I would get tape, and I would probably have them lie on their back, bend one leg or bend both legs, and just tape over top from ribs to pelvis. And then that would restrict extension. I would only do that if it was probably a fresh new spondylo. For the most people with a spondylo, I'm just gonna get tape over top of the erectors, because 9 times out of 10, the erectors are just firing like heck. And that firing like heck is going to cause extension. It's going to cause a constant level of irritation. And so really I'm just trying to allow a normal amount of flexion in the back, a normal amount of awareness in the back, and allowing them just to kind of use their core effectively, given the fact that they have a spondylo. And then I would take that to the core exercises that I would want them to do. Take that to whatever you were doing above and below in terms of hips, T-spine, shoulders, whatever you want to do in addition to that. I would just try to like normalize the tissue tension of the low back and provide awareness. Does that make sense? Good, excellent. Yeah, that's my. It's a tough one, but like, yeah, that's where I currently am at in my experience. And I think beautifully, like those two things cover most of the OA of the hip and low back patterns that we talk about. The only last thing that I'll mention is someone with adductor hypertonicity. I will many times get, if they have a decreased hip external rotation, we saw in the study the problem with internal rotation. If someone has a decrease in external rotation of the hip, I'm going to check the adductors. I'm going to check for inner thigh tension, and I'll get tape over top of that. And a lot of times I can maximize hip external rotation by getting those areas to relax. And if they're tight, a lot of times they'll be tight as heck. I'm going to do some soft tissue over top of the adductors and then get tape over it as my finishing move. Okay, thanks everyone. That gets us to our 1 hour mark. Time sure flies when you're having fun. I appreciate everyone attendance today. I appreciate you being here with the great questions. I look forward to seeing you for webinar number 21. We're picking up steam. I think we had over 100 people today, which is fantastic. Let's see if we can keep that rolling. Tell your friends, and we'll keep the contact coming. Last thing I'll say is jump onto our school's platform. Please post the topics you want, and we'll tailor the webinars to whatever our audience needs. Have a great day, and we'll see everyone in a month. Thank you.